Hi, I'm Dr. Simon Carlin from NOT Global, and it's my great pleasure to be here with Dr. Xanthe Hand, and we're going to have a little chat about how Dr. Hand got into the NOT process and kind of where she's got to in practice at this point in time. So welcome, Dr. Hand.
Thank you.
And also congratulations on your new blue Land Cruiser.
Thank you. I'm very happy about it.
Hopefully that takes you to all sorts of fun places.
Yeah, that's the plan.
So thanks for being here with us. I really just wanted to investigate, kind of how you got into using NOT to begin with, and then, what did you do with that to start off with?
Well, getting into NOT actually began with you, and I came and had a look and saw what you were doing with NOT in practice, and I just thought it was really different and versatile, and I really enjoyed it. I was like, wow, that looks amazing. I really want to learn more about it, so I did.
Yeah.
And it's been a really invaluable tool in my toolbox, both in terms of using it as a complete system, or factoring it in here and there. So it's been a really enjoyable process.
Awesome. And you're in a kind of volume practice setting now where there's a lot of people coming in, and so you need to move quickly and be efficient because there's lots more people to see this afternoon, so to speak. So tell us how does that work at the moment with you? What sort of technique process are you using, and where does the NOT fit into that practice setting?
So I do use mostly manual chiropractic techniques, I guess, and some low force techniques, but I do use quite a bit of NOT, both as like I said, a complete system, adjusting just NOT for some people, which a lot of people really enjoy and have seen awesome results with, and as an adjunct as well, fitting that in. So it's a really efficient system in some ways where you can really target something and go a lot of places with it. I guess that's what I mean by the versatility.
Yeah, cool.
You can kind of explore a little further deeper into their neurology and see how it's all affecting them in a relatively good time frame. So I find it really handy that way, where people can get really good results quite quickly, and they'll stand up and notice it.
Yeah, cool.
And be like, oh. So that's really, it's awesome.
So you're blending conventional manual technique and NOT and together really in your practice setting, and when you've got regular kind of patient stream running, you're seeing sort of 10 or 12 patients an hour who are on care plans. Is that how it works?
Yeah.
Okay, so it's got some pace.
Yep.
You have to work hard.
Yep.
You have to work hard. We appreciate all those docs out there working hard. So that's really good. And I suppose the other thing is, how does that work in the practice? Because I know it's a multi-doctor practice where you operate. There are 5 chiros there.
3 practicing, but 5 chiros.
Yeah, so 3 full-time chiros.
Yeah. How
does that work? Because sometimes you're seeing other people's patients as they're away or whatever. How does that work with the NOT process for you?
That's a little more tricky because in that instance I'm kind of acting more as a locum in that adjustment. So I just follow the protocol for what the other chiropractor's done. But what I have found really useful with NOT is that for people who have been adjusted their whole life or for the last 10, 20 years, and they've gotten amazing results with manual, but kind of hit a bit of a glass ceiling in some instances. You have a bit of you can change tack.
Like a response plateau.
Yeah.
They're not getting the same outcomes they were getting.
There's something that's niggly, it's not quite sorting itself out, it's coming back in between visits, or they're showing with the same listings. Yeah. So when you get to do a different technique, and I did it with a guy who has been getting adjusted for about 10 years, and he was doing well, but he wasn't doing great. And we changed and went completely to NOT, took some x-rays, and he had some lateral curvatures which didn't entirely resolve, but definitely improved. And he was just like, wow, I didn't expect that at this stage of my care.
That's really cool.
Yeah.
So you had a pre and post x-ray finding there,
Yeah.
so that's another thing,
Yeah.
where you could validate not only was he feeling better,
Yeah.
but there was a structural biomechanical outcome
Yeah.
to the change in care from straight manual to manual and NOT process.
Yeah, it was really cool. It was really powerful for him. So,
That's
and me.
fantastic. And you know, so you're still developing your practice down there. How do you kind of run your practice at the moment? You know, just to share with others. I mean, how does the practice operate when you see new people, and you know, where do you go with them, and how do you make those decisions? You know, in terms of, you know, their care plans.
Got you. Yeah, so we obviously do. We kind of run a bit of a Carter system, I guess, in terms of procedures, but they come in for their initial, we do all their testing, we often do x-rays to have a baseline and for their education as well as ours, and then go through their findings at the next visit. And for me, there are some people who are quite specific. I've had a few recently who are like, I don't want the cracking. You know, I don't want the manual, or I don't want anything heavy. I've seen many people and I want it to be gentle.
So you've got somewhere to go with them.
Exactly. And I say, well, this is the perfect solution for you. And they really enjoy it. And also for the people who we start with manual chiropractic and they're getting results, or they're not enjoying it as much, or I feel like they're again hitting a bit of a plateau in some respects, then it's my discretion, I guess, to change over and say, look, we're going to do it. It's going to, you know, it's going to look different to you. It's also going to feel different in a good way.
Yeah.
So, yeah, there's a lot of latitude with that, and so we see them relatively frequently in the beginning, and then it eases off over time as they improve.
Cool. And so you mentioned, you know, with imaging, it was for their benefit and for ours. I suppose to extrapolate from that question, how do you communicate the NOT process to the people, the new people, and also the people who are swapping over from straight manual care to the, you know, the NOT approach? How do you communicate that to them?
Yeah, that's an interesting one, because it seems less tangible, the feeling that you get from NOT, or in the moment anyway. So I guess it's describing how the protocols around it and how it was made in the first place. So talking about how we focus on neurological reflexes and unwinding the dura, and then getting different areas of the body stable, which to most people they go, that makes sense. And once you do that, you have a lot more freedom to do a lot of other really good work, and it just gets your healing systems functioning a bit better. And it's, you know, in effect the same kind of basic principles or concepts of chiropractic as manual, but it's just going about it in a different way. And again, like I said, you have a lot of versatility and also specificity. You can be really specific about things, like for example, the guy I took the x-rays of has had a few accidents here and there, and he's a footy player and everything else, so we get to test his neurology in those kind of settings to get a better outcome.
Right.
So
and then
he was pretty happy.
Then validate it with some imaging.
So it was awesome. It was really good.
Okay, wow, that's a great story. Dr. Xanthe, great to have you with us today, and that's a really good window for some of our junior providers or newer providers to look through, that you can blend, you know, your technique, your NOT technique and manual technique in basically a volume practice setting, so that's a window for some people that's what they're interested in creating or being part of. So it's really helpful, and thank you so much for sharing those insights with us. Really helpful.
Thank you for having me
with us today.
Yeah.